1, 2, 3. Hello, mate. Do you understand Irish?
Animals from all over the world
Bonjour.
come to see one extraordinary man who's known as the Bionic Vet.
High five. Yes!
Professor Noel Fitzpatrick.
We only get one shot at this. Here we go.
Noel and his team offer some of the most advanced treatments available anywhere.
The perfect marriage of mechanics and biology. This is what we have now, a brand new knee.
Oh, wow!
For some, it's a last chance.
It is a life or death situation because we cannot leave him like he is.
Just want you to do anything you can for him, really. Sorry.
As Noel continues to devise new ways of healing,
You're going to be bionic. Thank you so much.
he transforms the lives of his patients
Oh, that is just unbelievable.
He's raring to go.
against all the odds.
Boom! One small step for a dog, one giant leap for mankind. Well done.
Fitzpatrick Referrals sees animals of all ages. From the very young
It's like dropping off your kid to the nursery or something, you know, it's the exact same feeling. So they're always quite worried.
to those with a few more grey hairs.
When you do have older animals, you do see a personality come across, let's say.
They tend to not want to walk where you want them to walk. And they make a lot of smells. They don't smell the freshest when they get older, unfortunately, bless them.
But then we treat them differently because they are the older patients.
I think old dogs mean a lot to their families because they've grown up together, they've shared a large portion of their life together. So the older the patient, the more passionate and caring their families are towards that animal.
Whatever their age, all Fitzpatrick patients come here in search of the cutting-edge treatments on offer. Waiting in reception is one dog whose problem started as a puppy.
I know. Good lad. Good boy. Oh, I know. Not much longer.
4-year-old Springer Spaniel Luca is Barbara's devoted companion.
When he was a year old, we started noticing he had a limp. He came along here and he had his front elbow scoped.
Luca had keyhole surgery to treat developmental elbow disease of his front left leg.
He's been fine now for basically 3 years, but that limp's returned. I'm hoping that there can be some sort of surgical intervention because he's only 4 and he is so active. He likes to be out.
Barbara and her family live on a small holding in the Kent countryside with just a few other animals.
We've got 3 dogs, 2 horses, 7 sheep, about 12 chickens, a couple of ducks and some quails. I think we've always liked the outdoors life. We've always had dogs. This is an absolutely amazing spot to have dogs and to be able to enjoy the countryside. Luca is my constant companion when I'm outside. When I'm out working in the garden or doing things with the animals, he is always there. I think if you ask the rest of the family, they would say he's a mummy's boy. He's very loyal, he loves long walks, and he absolutely adores swimming. When I'm out and about now, he does have to be restricted because the limp is progressively getting worse. Controlling him is a challenge because he doesn't see that there's a problem, but clearly there is. Stay. So suddenly a lot of his things that he likes to do and he assumes he's going to be able to do have stopped.
All right, big fella. Off you go. Good boy.
Back at the practice, Noel needs to identify what's causing Luca's limp this time.
He's a bit lame, but not too bad today.
Okay.
But Luca isn't giving much away.
Okay, big guy, up we get.
Yeah, he's difficult to examine.
He goes quite rigid, doesn't he? He hides the lameness pretty well.
Noel is on the lookout for problems common to Luca's breed that may be caused by the poor fit of bones making up the elbow joint.
Okay, so the 2 scenarios that are most likely are there's a crack going down there.
Yeah.
Because probably there's a poor fit.
Okay.
And that's progressive.
Okay.
Or there's progressive erosion in here
Okay.
because it doesn't fit.
Right. Could he have both?
Yes. And it's very common. When can we get into CT? Can we go now? Do you want to go to CT? Go to CT then. Go on. Off you go.
Oh, you unloyal dog.
Maybe I didn't sell it well enough. CT's an amazing big donut that you go inside.
I'm normally with him when they do pre-meds and stuff, but I'm sure if you...
He'll be fine walking through
go.
this door. He'll rather go that way. Just walk ahead and keep going.
Shall I follow?
No, you're good.
Oh.
She's got it.
Yeah.
She's got it. Mummy, I would imagine, panics a little more than is necessary, but that's okay.
CT scans will help Noel identify which conditions Luca may be suffering from.
Now, Luca's mommy, please. Luca's mom. Right, okay. You have both problems.
Oh, right.
Both elbows.
Both elbows.
Yep.
How's he managing?
Because that's the way spaniels are. They want to eat, they want to run.
Yeah.
First, Noel focuses on the most critical problem. He has discovered splits forming within the bottom part of the humerus in both elbows.
So you can barely see it on the X-ray, but on the CT scan, it's hoochingly obvious. See that? So there's a giant crevasse.
Oh, crikey.
And, very importantly, there's increased whiteness on either side. And the reason for that is it's not healing.
No.
It does not.
Would it ever heal,
No,
though?
it never heals.
To prevent this crack becoming an outright fracture, Luca has the option of a standard screw to place across the bottom part of the humerus. But to avoid the risk of the screw breaking, Noel has designed a larger screw with a system for injecting a special bone growth gel around the metal. To tackle the other issue of erosion on the inside of the elbow, Noel may well need to cut the ulna and reset the angle to relieve pressure inside the joint. Noel will aim to carry out these procedures in both of Luca's front legs.
And I wouldn't choose to do this, but if you did nothing...
It is an option to do nothing, but the chance of fracture are high, given that the one that's splitting hard is really now opening up, and the other one's getting worse.
Hello.
All right, mate. Thank you, Hannah. I would discourage you from letting him run after stuff because he could fracture.
Okay.
He's on a knife edge, and if the knife cuts through, you got a big fracture.
Barbara must make a decision, and soon.
I'm just a little bit sort of flabbergasted with it all at the moment. I think a very large glass of wine is in order, and he can have some food. He's going to be wanting to run around, and that's going to be difficult living with that in the next few days, weeks, or whatever it is, knowing that something could happen to him.
I'm so broody for a new pup, but he really hurts my ovaries. Oh.
At Fitzpatrick Referral's Oncology and Soft Tissue Hospital in Guildford, Charlotte and Danny have come with their 7-month-old puppy, Bo, to make a tricky decision. Bo has a problem that has affected all their lives.
Oh, she's dripping really bad today. When we first got Bo, she was 8 weeks old, nearly 9, and we thought she was a puppy dribbler, as puppies do, dribble urine. Then when she got to about 5 months old, I thought this should have stopped by now. When we first got her, we were hoping she'd been going to work with Danny, but unfortunately, because she leaks urine everywhere, she can't. So that means all my breaks from work, I'm shooting home, spending all the time we can with her.
Lots of cleaning.
There's just so much cleaning to be done.
At home in southeast London, Charlotte's work is unending.
Cleaning routine is pretty relentless. It starts as soon as I get downstairs. I have to clean all of the previous night's bedding, clean her bed down, clean the kitchen floor, clean the dog. By the time I've actually managed to get all the washing in the washing machine and the floor clean, she's actually dripped somewhere else. So I always seem to be 2 steps behind her with the cleaning materials. And it's just a constant cycle of one lot of washing goes in as one lot of washing's coming out. You think you're safe, the carpet's clear, it's fine to walk across it, and as you get in there, you stand in something and you're like, oh, it's a wet sock. As much as she makes us laugh, this has all been quite difficult for us as a family. The thought of her staying as she is quite frightening because she's going to get bigger. The puddles are going to get bigger. This could be the rest of our lives with her. So it's brought a lot of tears and a lot of difficult decisions.
The family are pinning their hopes on senior clinician Gerard McLaughlin.
Hey, is that Bo?
It is, yes.
Hi, how you doing?
Who specialises in minimally invasive surgery.
Perfect, so we're just going to have a look at her as well. I'm just going to put on some gloves because she's a little bit pee-stained.
Yeah, she's left you a puddle in the
Right.
waiting room as
A
well.
little present. And as she gets excited, does she pee more?
Yeah, and she pees more when she eats because it's like, oh, it's food.
Infection is the biggest risk to Bo's health.
Yeah, it's all stained and it's quite red and angry looking, everything back here. It's absolutely soaking wet, and you can see why she's going to get infections here. Yeah. Because it's just such a nasty environment for that to sit there, isn't it?
CT scans and ultrasound from Bo's local vet suggest she has an ectopic ureter.
So if we think about a normal urinary tract of a dog, and you have 2 kidneys, and from the bladder is the urethra, and that's where the urine comes to the outside. There's 2 tubes, a tube that comes from the kidney to the bladder called the ureter. And in a normal dog, it enters well within the bladder like this. And so the urine is formed in the kidney, comes down here and into the bladder, and then she pees it out. And actually one of her sides is like that.
Yes.
So she's got one side that's doing its normal job, which is great. The other side, the tube comes down here, and it still enters in the normal location, but instead of opening there, it continues on, and it opens down here. And so the urine is filling out straight into the urethra, and there's no continence there. So traditionally, people would have done a surgical procedure, so it's quite a big thing to put her through. It would involve opening her entire abdomen and tying off this abnormal ureter, reattaching it to the bladder, and there's risks associated with that.
Yeah.
So what we're able to offer here is a minimally invasive treatment where we use a laser to correct it. And we're going to just take away this top part of tissue, and we're going to open that so it's back within the bladder.
But every operation carries risk, and there's no guarantee it will be a complete success.
With this procedure, we'd expect a 50 to 60% continence. But with this condition, it's not unusual. They have concurrent problems of their urinary tract. So for instance, they can have weak sphincters around the opening of the urethra. The urethra can be much shorter than normal. So those are the dogs, they're the 40% that won't become continent. But I think it's a risk you have to take because she can't go on like this, getting infections and dribbling urine. It's not fair on her.
You'll be good. Mummy loves you. Love you, babes. You're going to be fine.
Although, like any procedure, the results can't be guaranteed.
This is Bo. She's super cute.
It's a gamble Charlotte and Danny are prepared to take.
The waggy tail.
We've got about a 50% chance of success, which is what we were hoping for. So we're just hoping and praying that everything's going to go as planned. All going to be good. We've got faith.
You get a puppy because you want to play with it and socialise it, and it sits on the couch and give you cuddles and stuff. They've not been able to do that. Would I have a dog in my house that was dripping urine all over the furniture? No, and I think it's a lot to ask someone to live with, and they've done it for 7 months.
I'm nervous, stomach's turning a little bit. I'll be happy when we've got a phone call saying, right, she's out.
At Fitzpatrick Referral's sister hospital in Guildford, 7-month-old puppy Bo is about to have laser surgery to treat her incontinence. The procedure will be performed by specialist Gerard McLaughlin.
So what we're going to do is use the camera to go in and visualize the area, and from that we're going to pass a wire and a catheter up the abnormal opening, and then we're going to use a laser to take that ureter and cut it back into the bladder. So Urethra, there's the ectopic ureter there, so see that hole in the bottom there? That's abnormal. So that's what we need to laser back there. Yep, great, yeah.
Gerard uses a catheter to protect one side of the ureter. He follows it with a laser to burn away the unwanted side.
So we're just slowly cutting away this tissue here.
The on-screen image is highly magnified. Gerard has to work carefully within a tiny area.
Particularly because she's got lots of infections just now. If we burst the bladder with the laser, then suddenly she gets all these bacteria through her abdomen, and that becomes a life-threatening emergency, so we have to be really careful. I think it looks like we're pretty much done rooting back into the bladder. So that's her. So she will go home tonight. There's a 50 to 60% chance she'll be completely continent now.
It's okay. Are you waking up? What happened? It's been a bit funny.
Just 2 hours later, Beau is out of the recovery suite, and Charlotte and Danny are back right on schedule.
It's now 4 o'clock on the dot, as we were asked. We weren't going to be late, so we've been here a little while waiting.
Come on.
Even so, they've got to wait a little longer while Gerard tests the water.
Come on.
I'm apprehensive because I'm afraid, with our luck, that it's just not going to be as plain sailing as we'd like.
This is her just recovered. We're only like a couple hours after the procedure, and she looks dry. I can't see any dripping at all.
Fingers crossed. We've had all the stress, all the upset, and now we're going to have the good times and be able to enjoy her for the next 13 years.
I'm really keen to see what she looks like with her mum when you come to collect her, because when she gets excited and things, that'll be really interesting to see how she does. But yeah, I'm really pleased with how she's doing so far. Hello, who's this?
My baby. Are you sleepy, little chicken? Hey, you look so sleepy still.
When she first came in here, she was dripping all the time walking around here.
Yeah, we're really wet inside.
Yeah.
I can't see anything.
Everything will be a bit inflamed and things like that, so we just need to give it a few days to settle down.
Like you said, time's settled, isn't it?
Yeah. Perfect.
Thank you so much.
Not at all. Lovely to see you guys.
Beau may still have complications.
Let's go home.
And it will be 10 days before the family know for certain if the procedure has worked. It's Sunday afternoon, and an urgent weekend case has arrived to see Noel.
It's Ivor.
He's an 8-year-old Newfoundland.
A couple of weeks ago, he actually collapsed in the back garden, and we've been backwards and forwards to the vet. But yesterday we got up, and he was having problems limping the front, and he couldn't move his head from side to side.
Yesterday was a different level altogether. Having our little girl, seeing him in so much pain, and she says, "Oh, Ivor's sad."
We have a 3-year-old who loves him to bits and wants to just give him cuddles all the time.
He wouldn't
But
harm a fly, would
he wouldn't hurt anything. He's a gentle giant. He's 8 years old, but he's still a puppy. Yeah, he's a troublemaker.
Our vet seems to think that it could either be a slip disc in his neck or a tumour, a bone tumour. It gets me all upset, but I hope it isn't cancer. If it is, I think the kindest thing to do would be to let him go. But we'll just have to wait and see and cross that bridge when we get to it, I think. Yeah.
Giant breeds like Newfoundlands have shorter lifespans, and Ivor is now in his twilight years.
You're an old man, aren't you?
Ivor's mum and dad. Are they ready for you?
Come on then.
Hello, what's your first
Sorry.
name?
Nice to meet you, Nicola.
Nicola and Dan. Okay, can I see him walk? Good boy. So he's quite ataxic, wobbly. Is he normally that wobbly?
He normally has a bit of a wobble, but not as bad as
Ivor.
this.
Come on.
Right, let me just check him. You support his tummy, please.
Noel checks for nerve damage.
Right, so that's a knuckle test. It's okay.
He's never done that before.
Okay, that's not okay.
I mean, no, he's 8 years old. He's
Yeah.
He's a new feed.
Yeah, what's his life expectancy in your eyes?
8 to 10.
At the very
Yeah, I know.
most.
We have to be very careful morally what we do here. You know, because we wouldn't want to be putting him through major stuff, you know what I'm saying?
Yeah.
Just going to check his neck. Hold tight. He's quite stoical, isn't he? The symptoms most likely fit something high up in his spine, because it's unlikely you're going to have a front leg affected if it's not above that. I'll find out what's wrong, and then we'll decide what to do next.
Okay.
That's all we can do.
Yep.
MRI and CT scans will reveal whether the cause of Ivor's wobbliness is a disc issue or cancer.
Thank you very much.
It's sad when you have walked out and someone else has taken him,
Someone else has walked off with your dog.
but you're walking out with his lead and his collar. It's a bit like, that's it.
It does feel like we're never going to see him again. But...
You've done the best thing. You've done the right thing. I think that's... We keep ourselves busy until we get that phone call, really.
Yeah.
Okay, so we just had the images through for Ivor now. So big decisions for Dan and Nicola. Good news and bad news. Good news, it's not cancer.
Okay.
Bad news, it is a very bad disc.
Okay.
So even though this is an 8-year-old dog and in real life may not live to more than 9 or 10, we are unfortunately in a surgical situation.
Okay.
Meaning that it's not going to go away on its own and it'll probably get worse. It is the source of significant pain. I could give him medicine for pain, but we just don't think it's going to cut the cheese because he's in too much pain.
Yeah. Drugging him up all the time. It's not really what I want to do. But okay.
So I guess the only decision I need from you is, do you want me to explore the possibility of surgery?
Yeah, definitely.
Okay.
Noel's solution is to remove the damaged disc and, using spacers, spread the vertebrae apart and allow the spinal cord to recover. A custom implant will be made for Ivor over the next few days. It's mid-morning at the practice. Barbara and her loyal Springer Spaniel Luca are back. Noel's worst fears have been realised.
He was booked in to have surgery on both of his elbow joints, as sort of discussed with Noel. He advised that he had these cracks in both of his joints and they could go at any time. And he said, as I went out through the door, he's on a knife edge. And I went away thinking, that's a bit dramatic, he's been fine.
Before the scheduled surgery could take place, fate intervened.
He went out through the door. We don't know quite what happened, but there was this almighty scream. And I came running down and he was so literally lying on the ground screaming, but with his leg up in the air. His front left elbow joint fractured. It was awful. I've never heard a sound like it, and I hope I don't hear one again.
Noel's colleagues were forced to do an emergency operation on Luca's fractured elbow.
Hi, Barbara.
Hello there, hi.
Hello, Luca. How are you? You were in the wars, mate. You've been in the wars. What happened to him was something that, you know, I could see happening.
Yeah.
Unfortunately, it happened quicker than we both had hoped. Mm-hmm. Now, what they did was the very best that can be done right now nowadays in terms of a fracture, which is to put a 4.5 millimeter titanium screw through that. But unfortunately, osteoarthritis is inevitable.
Yeah.
Because you fractured into the joint.
6 weeks on from the emergency repair, It's now more crucial than ever that Luca has surgery on the other elbow.
Now, what we want to do on the other side is three things.
Oh, sorry.
We want to prevent fracture.
Yeah.
We want to minimize the potential for osteoarthritis.
Yes.
And we want to give you something that's going to last till the death of the dog.
Yes. Sorry, Luke.
Go, good boy. That's it, he's off.
Luca is taken straight through for surgery. Noel is using an arthroscope to investigate his elbows. First, he checks the joint that had the emergency repair to see if anything can be done to improve the outlook for the left elbow.
So there's where the fracture was. It's this I'm concerned about, this surface of the ulna rubbing against this surface of the humerus. So if we cut the ulna and drop it down, we might help the joint a bit.
Noel then looks inside the other elbow.
Okay, so on this side, there's a crevice right there. And you can see, in fact, that as I wobble this, that crack opens and closes. And eventually that will fracture right through. Okay, so the first thing I'm going to do is I'm going to pop a blade into the joint here because I want to cut a tendon down here that pulls the ulna against the humerus. There you go, cut. So this is one mechanism I'm going to use to reduce the pressure between the ulna and the humerus. I'm going to cut the ulna and let this surface here drop down a bit away from that. Okay, so that's the intra-articular bit of the surgery done inside the joint. Now I'm going to cut into the joint and try and put this special screw in here.
Noel hopes the screw will hold the deep crack in the humerus together. It has to go in exactly the right place.
We're now down on the inside bottom of the humerus.
He uses a guide printed from the CT scan of Luca's elbow, which he secures with pins. Now he can drill the hole.
We sure as hell better have this central at this point or we'll be drilling in the joint. That's one big hole. You see right down that.
He uses a thread cutter to prepare the aperture for the centerpiece of the operation.
So this is a highly specialized screw. I'm going to inject fluid down the center of the screw. It's going to extrude through this hole into the space in the bone between the two threads, giving me a 0.5 millimeter of bone stimulating gel around this core. So this gel contains one of the most valuable substances on the face of planet Earth, which is called bone morphogenetic protein. In fact, per gram, it's 500 times more expensive than gold. But the amount in here is about 4/1000 of a gram. Beautiful.
With the screws safely in place, Noel cuts the ulna to further release pressure within the joint. To avoid Luca needing further surgery, Noel also cuts the ulna in the left leg.
There you go, Luca. You won't thank me now, but you'll thank me later, hopefully. All right, Bubba. See you in CT.
So this is always a nerve-wracking moment because there's no way back if the hole's in the wrong place. So it needs to be dead center. On that view, it looks good. There's the aperture through which we put the gel. There's the cut in the ulna there. So that's really good. It's 11 millimeters from there to there, and that's 5.5 millimeters of metal and 1/2 millimeter of bone-inducing gel. Okay, that's great. Thanks so much. Thank you.
It's now crucial that Luca has time to heal. Another fracture could spell disaster. At Noel's Guildford practice, Bo, the Labrador puppy, is back to see Gerard. It's 10 days since she had laser treatment in an attempt to correct her incontinence. But Charlotte and her daughter Olivia are worried that the operation hasn't cured the problem.
Hi, how are you? Nice doing. Hello, I see you too. And you come.
Steady.
See you. No. I guess the big question is, how's her pee?
After I'd been really excited and everything was good, she decided, no, I'm going to prove you wrong now, Mum.
Okay.
We've had 2 dry nights.
Yeah.
A few slightly damp, but then this morning we got up and she was absolutely drenched.
Okay.
Gerard will need to reassess what further treatment Bo needs if she is ever to be fully continent.
I'm hoping that he's going to tell us that she's going to get a bit better, because obviously we want it to stop completely. I don't think it will stop completely, but I think a bit better would be perfect, and then it's just livable. It can be cleaned up.
First, Gerard wants to check if Bo has any residual infection.
We're going to get a urine sample directly from the bladder because she has had recurrent infections and that's part of her condition. If she's still got an infection there, then that could be predisposing her to having further incontinence and wetting of her bed and things like that.
Come, you're fine.
In her excitement, Bo leaves a strong impression on Porrig by releasing her anal glands,
All over porridge scrubs.
leaving a lasting scent.
Her bladder's
smell bad.
pretty. Okay. So that's all we need just for bacterial culture, and then as well as emptying her anal glands for porridge, she's just peed all over him as well.
Oh, it isn't like a little bit, is it?
So like a flood. Good girl, peeing all over porridge. Well, that's a win-win for everyone involved.
Hi, Bo. I've heard she's caused chaos. I'm really sorry.
Only mild chaos.
Yeah, I can smell you've caused chaos.
Luckily, I was at the front end, so it's all fine.
Yay, you're all right. You're good.
I know. She's going to get in the car like
In fact, I think
it'll be another bath, I think.
If there is infection, Bo will be prescribed medication
There we go.
and further treatment for the weakness in her bladder sphincter.
Come on then.
Hopefully then she will finally be dry. Ivor, the 8-year-old Newfoundland's custom-made implant, is ready. Surgery can now go ahead.
My objective is to get in, take the disc material that's squishing the spinal cord and nerve roots out, put the spacers in, and get out.
Spinal discs lie between the vertebrae below the spinal cord. Noel will get access to the spine through Ivor's neck.
Okay, here we go. So this disc is in a tricky spot. It's quite near to the entrance to the chest. We could get quite a lot of bleeding in here. Oh, shit. Okay, so that's our first bleeder. That means we're in far enough, that's for sure. We know when we're in the right spot, taking the material out, it's going to bleed like crazy. So we just push collagen in there like that, and then that stops the bleeding.
Having removed the damaged disc material, Noel can now insert the spacers.
So as I drive the spacer, it pushes the vertebrae apart along the groove that I've created for it. Dog like this. The bone.
Newfoundlands are one of the biggest breeds in the world, so Noel is using 2 spacers side by side. To secure the spacers in place and prevent collapse of the vertebrae around them, Noel will attach a custom-made link plate based on CT scans of Ivor's neck.
The 2 spacer devices are going to attach into here. They will then be linked into 8 screws, 1 in each of these holes. The screws lock in so they can't back out. 1 vertebra here, 1 here.
With all the screws in place, Noel packs bone marrow he's taken from Ivor's shoulders around the vertebrae to help them fuse together.
Everything's now rock solid. We're going to stitch up. For 90 minutes of surgery, we could give 1 to 2 years of life, hopefully pain-free and happy. What's not to like? Hi, Nicola. So I've done the operation.
Oh, fantastic.
The post-operative imaging looks good.
Yeah.
So everything went in the right position.
Okay.
If he improves well over the next 48 hours, I'll consider sending him home on Sunday.
Fantastic. Thank you so much, Noel. Really appreciate it.
No problem. My entire pleasure.
Are you playing? Are you playing? Are you playing? Oh, good boy. Oh, it's a good boy.
Four days ago, Luca the Springer Spaniel had multiple procedures on both front legs. Barbara is back today to take him home.
I'm a little bit apprehensive as to what sort of dog I'm going to find, because I think he's going to be lame on both legs, so a little bit apprehensive.
Hi Barbara, how are you doing? So this is what we have now. This is the big screw.
Oh, okay.
So that should be pretty rigid. That's a pretty big bar.
Okay.
The next element of both surgeries was cutting the ulna there.
There.
Because it's supported by the radius, it heals pretty quick.
Okay.
So, I'm very pleased. He's doing great at the moment. Are you coming in? Come on, bub.
Hello. Hello. Oh.
So even though he's had both bones broken, he's actually doing remarkably well. But he doesn't seem to be too bothered, to be honest.
You've got two poorly legs, haven't you? You have been through it, haven't you?
As it nears sunset, Noel is checking up on Ivor.
Go on, buddy.
The old Newfoundland.
He's on day 3 after surgery now. He's doing remarkably well. He's still a little bit wobbly on his back legs, but not much. For an 8-year-old dog to be doing this well after a major surgery like that, it's very hard to argue that you're not going to give him another year or 2 years of life for the sake of 90 minutes in surgery. And he's such a lovely boy, so I definitely think we made the right decision. Come on, buddy. Now, Ivor's folks, please. Hi, guys.
For Nicola and Dan, the wait is over.
It's nice to see you smile.
Yes.
He's just rallied. He's bounced right back. I mean, I hate to be too optimistic too soon, but he really has. Our job was to go in underneath here, so you can see here where there's 2 spacers, and you can see that the saddle acts like a grappling hook and holds those vertebrae together.
Oh, wow.
Okay. It's quite an advanced piece of machinery, and you can see that what the 2 spacers do is they push apart those vertebrae so that there's no pressure on the cord in here. He should live a normal lifespan having had this done, so I think it's definitely well worth doing.
Good.
All right, come on, Ivor.
Hello.
Hi, look who's there. Look who's there. Yes, there you go. Hi. He's still wobbly. Spinal cord obviously damaged by the disc, and then slowly gets better.
Thank you so much.
You're very welcome.
I think he's going to be back to normal very quickly.
You could see as he walked in, he was eyeing up the bones on Noel's desk, and I'm sure he was thinking I could have one of those.
Yeah. He's been in this pain for so long, and we haven't known. Noel said he's recovered extremely quickly, which is amazing news.
He still stinks, though.
He does.
He does stink.
Bo, the incontinent Labrador puppy, has now received medication as well as laser treatment. Finally, she's home and dry.
Since the operation, Bo's been doing amazing. 95% improvement, which is unbelievable. The washing's cut down, the cleaning's cut down. We weren't living, we were existing to keep the house and the dog clean.
Bo is now welcome out in public without Charlotte, Danny and Olivia worrying about any accidents.
Her quality of life for her and for us has improved dramatically. We know as long as she's had a medication that she's going to be fine. It's the little things in life that people take for granted, being able to go out to a pub with their dog. We can now do that. We can just live.
She just loves life. She's such a gentle soul. I'm just glad that she's been fixed because I know she was feeling sore by it. The fact that she's fixed and she feels better, that's what makes me feel better. I still melt when I see her.
It's 6 weeks since Springer Spaniel Luca had surgery on both his front legs. Barbara is back at Fitzpatrick's, but she's worried that once again there's been a setback.
Hi, Luca.
Hello there.
How are you? Nice to see you. How is he doing?
He was doing absolutely fine, but we did have an issue over the weekend where we had a bit of a yelp. My son came back from uni and he rushed to the door because he wasn't in the cage. And then I think he went to pick something up, and I think that's when he might have just...
So has he had periods outside of the cage?
Well, I mean, he's in the cage, but when we're in our kitchen, for example, I'll have him out.
I guess ideally he would just have total strict cage rest.
Really? Okay.
Yeah, yeah.
He was doing...
Because you got to remember, he's got a fracture in there.
Yeah.
That's the problem. Anyway, it is what it is right now. Let's check it out. Okay.
Yeah.
Come on, mate. Good boy. Come on, mate.
Hello. Hi. Well, he's taking him in. Noel's not happy with me. No.
Scans will show if there has been any damage to Luca's front legs.
Hiya.
Hi.
Everything's okay?
Oh.
I mean, I think he just jarred it by possibly slipping or something like that, but the implant is fine. So it's healing, but not healed.
Okay.
So that will take somewhat longer.
Yeah.
Luca is also taking longer than usual to come round from the sedative.
But we want to tell you when you can let off lead, because we were aiming for 12 weeks, remember?
Yeah, I know.
Yeah.
I've got that date
Yeah,
very much in my radar.
Yeah.
Okay.
I'd like him to stay calm, and I'd like him not to jar it if possible. We need it to heal.
Yeah.
We've a lot of biologics in there now to
Yeah.
try and get this bone to settle down, as well as mechanics.
Yeah.
And that takes time.
Yeah, I know. I'm having this rather than a new bathroom, so it's...
Oh, I'm sorry.
No.
Far better than a new bathroom. I haven't had a new bathroom for 25 years. It's far better.
Let's just walk. Let's just walk. All right, I'll do you a deal. One more lap and you can go home. Now, Luca.
Hello,
much more awake than you.
Hello. What are you doing to your tongue? It just look very silly.
I think it's a new look that he's
It's not a good look, is it, Poppet? Yes, I've had my knuckles wrapped completely. Felt like I was really put on a naughty step and told, no, you know, he should be in a cage. And if he's out of the cage, he has to be tied to my leg, apparently. But no rushing around the kitchen, rushing to the door as he'd done before. But it's healing, and it's healing really slowly. So we've got to go back to the drawing board and make sure we manage it better now.
Over in Windsor, 6 months after his spinal operation, Ivor is back enjoying being fussed over at home. After cage rest and lead-only walking, his vertebrae have now fused and he's been signed off. Dan and Nicola's 2 daughters, Esme and Nora, have their playmate back.
Straight after the surgery, he seemed to recover and get back on his feet quite quickly. Within a week or so, he was much better, like a puppy again. He was up to no good within a week of his operation.
Yeah, but he's pretty much back to his old mischievous self.
What? He actually had the whole thing. Look.
All right. Where's the ball?
With the bionic implant alleviating the pain in his neck, he's no longer wobbling.
He's a bit slower than what he was.
He's definitely now showing that he's an old man. But I'm definitely pleased that we did the surgery. It means that we've got a bit more time with him.
Come on.
We've made his life better, and he is a joy to be around.
Quick, go. You're it.
I don't think we've got a huge amount of time left with him, but we'll try and make it as fun for him as possible and as fun for Esme as possible, so she can remember him.
Good boy. Good boy. Other paw. And the other paw. Good man.
And in Kent, Barbara and her family have been following Noel's instructions to the letter. and Luca is getting back up to full strength.
We are hopefully on the sort of final straight. He's still lead walking, but in 6 weeks' time, he should be sort of, you know, completely off the lead.
Luca is now able to enjoy his favourite pastime, a bit of daily aqua therapy.
Noel said it was fine for him to go swimming, and so we can do that with a clear conscience and think we're still abiding by the rules. He just loves it. He's really, really happy. You know, he pulls me all the way. As soon as we turn the corner, I'm being pulled off my feet. And I think he's happy. He's really, really happy doing that again. Noel's given our dog, hopefully, another 8 years of active life. And that's, you know, that is, you know, immeasurable, really.